Well, let's go to Dr. Oliver Johnson now, who's from the King's Health Partners, a group which brings together medical research and clinical practice. He's been working with the government in Sierra Leone, and we can speak to him now. Dr. Johnson, thank you very much for your time this morning. I know you have just returned from a trip to Sierra Leone. Is that right? Tell me about that.
Yeah, so I've been out in Sierra Leone for the last 2 years, based at the main government hospital. So we were there helping to strengthen the health system before Ebola hit, and we've been there for the last year. And I just got back last night to a city that's still very much, facing transmission. There's still cases cropping up around, particularly the east side of the city. It's down a lot from what it was a few months ago in November and December. But I think everyone's very mindful that there's a big job ahead to try and get to a resilient zero, which is what we've seen in a challenge even in Liberia next door.
You'll be aware of the criticism about the speed of response internationally. Having seen it firsthand as you have, what do you make of that criticism?
So we were, very much in the room in the first meetings a year ago after the case in Guinea was first identified as Ebola, and I think I would agree with MSF's criticism that WHO was slow to appreciate the scale of the outbreak and so to marshal the kind of resources and deploy them on the ground that we needed to get this under control quickly. And I think it's very important that we learn the lesson from this. We don't, if and when we get to zero, we don't just carry on as normal, but I think we've got to think very carefully about whether or not we've got the right kind of leadership, the right kind of institutions, and we're investing enough to make sure that future outbreaks can be detected and shut down early.
So what did you see? You talked about those early meetings and the lack of communication. Was it that people didn't want to hear the message that was coming to them from the ground, or it was literally not getting through to those who could start bringing in the numbers, spending the money, getting the help in? What was the problem?
I think it was a few things. I think Ebola was obviously very new to West Africa. I think it took a lot of time for people to get their heads around the idea that, this kind of Ebola outbreak could be seen in West Africa. We're used to seeing it in the Congo and Uganda elsewhere. But also the idea that this outbreak could be very different to previous outbreaks. Previous outbreaks have been 400 or 500 cases tops, and I think no one could anticipate, or people refused to anticipate, that things could go so badly wrong. But I think there was also sometimes a fear of public panic or of political damage that could be done by being too publicly outspoken about how the outbreak was starting to get out of control, and probably a lack of resources to really analyse the data, to really get out into the field and to find out what exactly was going on the ground.
What's, in your estimation, I mean, if there were another outbreak of a disease, Ebola again, or a different variant of Ebola tomorrow, what's to say that the same thing wouldn't happen again, that there would be a lack of communication, that it would spread, that there would be real problems caused? What's different now? Has anything changed?
Well, I think not enough has changed, actually. I think we have got to look at our international institutions and ask ourselves, do they have the right kind of leadership and the right kind of systems for communication so that they can pick up on problems early, but also so that there will be a strong commitment to talking about them publicly and to making difficult decisions. But alongside that, I think we've got to really increase our investment so that those teams in Geneva and elsewhere actually have the kind of manpower, the kind of expertise and resources to do their job. Because over the last few years, we've seen cut after cut on the WHO and other international budgets for these sorts of departments, which are facing multiple crises around the world as we speak, be it potential measles outbreaks or MERS outbreaks in the Middle East. So at the moment, I think we've still got a lot of work to do to stop these sorts of outbreaks happening again. Probably the NGO community and the donor community is more prepared, and there are a lot of more medics like me and teams like the one from King's who are prepared to deploy. But I think the structures are the same as they were, and we've got to learn the lesson and just not let this pass us by.
Dr. Johnson, thank you very much for your time this morning. Dr. Oliver Johnson from King's Health Partners, just returned from Sierra Leone.